But now, the maternity and gynecology ward of the Upper West Regional Hospital is in dire need of help. The 40-bed facility admits at least 60 pregnant women in a day, forcing some of them to deliver and lie with their babies on the bare floor. On JoyNews agenda today, Upper West Regional correspondent Rafiq Salam reports that babies are packed like sardines and wrapped with their mother's cloth for easy identification and kept under one radiant warmer borrowed from another department.
The Upper West Regional Hospital was established over 40 years ago, first as a district hospital before being converted to the status of a regional hospital. It serves a projected population of over 700,000 people in the region and beyond, including persons from neighboring Burkina Faso and Ivory Coast. In fact, it is the last referral health facility in the northwestern belt of the country. The gynec and maternity ward at the hospital has 40 beds. However, on the average, it admits at least 60 pregnant women in a day. At least 15 babies are also delivered here every day, thus overstretching the facility in a way that puts the lives of women and their babies in serious danger. Here, the patients have outnumbered the number of beds, forcing some of them to sleep on the bare floor. Dr. Nabanabas Gandao is a gynecologist and medical superintendent of the Upper West Regional Hospital.
Those that deliver after delivery should have their own ward. And those that are pregnant and come with some medical condition or condition should also have their own ward. And then those that are operated should have their own ward or cubicle. That is the ideal thing. And everybody is mixed up, those who are here to deliver, those who are pregnant and sick, and those who have delivered with their babies in hand. The babies may take infection home, and then we wouldn't be able to cure that.
Another issue of concern is the inadequate radiant warmers at the labor ward. Here, babies are wrapped with their mother's cloth, not only for easy identification, but more importantly, to keep the fragile-looking babies warm. They are packed like sardines under the only radiant warmer borrowed from the neonatal intensive care unit. Dr. Gandao again.
So what is it? Yeah, this what we call radiant heater or radiant warmer, which is actually very sophisticated. It measures the temperature, it gives alarm so that you don't overwarm the babies. You realize that we have 3 babies in one warmer. Under normal circumstances, we should have had them line up all around so that if you deliver 4 or 5 babies at a go, within 30 minutes, 1 hour, you can put all of them over there to each one in its warmer so that you don't have to pack babies in one day. It has a lot of risk, even though very minimal. These babies are very healthy, but you may have a baby you deliver that is not quite healthy. You need to mix with this. You realize that we don't have, each one is wearing the mother's cloth, so it's easy for identification. But if I'm coming to see my baby in this position and I realize that my baby is the worst among them, anything could happen. They are also tagged, they have their name tags after delivery, but it's not the best.
The size of the maternity ward is another concern for the midwives. It is about 1/4 of the size of a soccer field. Hajia Uzuma Andani is the midwife in charge of the maternity unit. She is worried that the limited space available here denies mothers any form of privacy.
This woman like this, one will be pushing, the other one will lie down and be looking at her. That means there's no privacy. This bed should have been divided, and so that any patient delivery, her colleague will not see what is going on. Then these beds is just recently our regional director brought us some new beds, and the management too supported us with some few beds. So the beds are not adequate, and the room too is not conducive for regional hospital labor ward.
She also wants an increase in the number of midwives at the facility. Many of them are not able to work properly. Their working is crooked. Is it as a result of this work?
Yes, it's due to the work. Because delivering a case, you can, when you want to deliver a baby, you can't stand straight and deliver. You stand some way before you deliver. And gradually you see that your walking style will change. You will develop waist pains. Some of us develop hypertension because of the work. If they increase our numbers, it will be better. The workload will be better, which will reduce all these problems.
Maternity wards the world over are supposed to have operating theaters attached to them for emergency operations. However, in the case of the Upper West Regional Hospital, women who are in labor and need emergency cesarean operation are wheeled or 1,200 meters to the hospital theater where other operations are taking place. Sometimes they fall off from the trolley.
The patients they are operating there, if an emergency happens, it means that they have to either interrupt that operation if it's also not urgent, or wait till they finish the operation, by which time the baby might have died inside the abdomen, the tummy, or both mother and baby would have been in danger of death. So this is the situation. So you realize that we have nurses having to move with patients from that distance at the site of women. Doctors and nurses too, if they are called for emergency, they have to come in their theater dresses, just like Dr. Danso and Mr. Mohammed, because you don't have time to change to come in here and sort out the patient. But if the theater were available, they just come out with a cover-up like Mr. Mohammed has done, and then they review the case. If they need to push the patient into theater, they do exactly that.
While babies and mothers receive this level of care in the existing facility, work on a 160-bed regional hospital is moving at a snail's pace. The people here hope that government will begin to consider the completion of the project as a life-saving imperative. Reporting for JoyNews, Rafik Salam. Wow.